amazing. About 500,000 people nationwide seek medical care for burns. Household burns lead to nearly 7 out of 10 admissions to burn centers. How many of us have left the grease on and panicked? It's happened to me, and what could have happened is just devastating. What's the youngest you've ever treated in terms of
Well, the youngest patient I've ever treated was a 6-month-old little girl. But we do tend to see in the United States, it's more men, young men,
Really?
that get burned because, well, they tend to do. There's a lot of work-related injuries. There's a lot of war-related injuries, and fires and things.
And we have a different type of burns. I want to show this to our viewers so they can see the difference. There is thermal, radiation, chemical, and electrical. Which is the most frequent, doctor?
Well, the thermal is the most frequent and the most devastating when you have actual fire touch a patient, which is what Ralph had.
Exactly.
Because the heat spreads so fast and so deep. They can all be devastating in their own way.
And we have a graphic showing complications from burns. Let's show this. That's why it's so important to tackle it immediately. Infections, doctor, low blood volume, dangerously low body temperature, breathing problems, scarring, bone and joint problems.
And it's very important you get to a burn center. If you have a burn, and let the burn experts
I had all those.
You had all this.
I had every one of them.
And that's why you were taken immediately to Jackson.
Well, sure. I mean, as we know, the skin is your biggest organ, right? And once it gets compromised, the risk for infection, it's not, at least the way that they explained it to me, if the burn doesn't kill you immediately, it's the infection that'll get you, right? It's not the burn, right? It's the infection breaking everything else down in your body, and you can't fight it. So.
And I remember that in ICU when we went to go see you, and they would limit visitations because of the infection.